Okay, I'm going to do a full scan of the room. Getting the floor. Over here, supplies. Ceiling. Walls. Okay, I'm going to flip. I'm going to be performing hand hygiene. Introduce myself. My name is Hailee Tillery. I'm the nurse practitioner student from the University of Memphis, and in the fall 2021 semester, I'm going to be doing the full head to toe assessment. I'm going to start off looking at head and face. I'm going to be looking for color, temperature, moisture, texture, edema, turgor, any scars, lesions, bruises, or nevi. None noted. Then I'm going to go ahead and go onto the scalp and inspect the scalp for any hair distribution, hair texture, hair color, any lesions, masses, depressions, any areas of tenderness, any infestation. Everything looks good. Next, I'm going to go on and palpate the temporal arteries for tenderness. None noted. And then I'm going to check the preauricular, lymph nodes, postauricular, occipital, tonsillar, submandibular, and submental, the anterior cervical, posterior cervical, and supraclavicular. Everything feels good. I'm going to check now the cranial nerve 5, so I'm going to get you to close your eyes for me. Checking sensory first. I'm going to, you tell me where you feel this?
Right cheek, left cheek, chin, nose, forehead.
Okay. And then I'm going to check you can open your eyes now. I'm going to check the motor function, so I'm going to get you clenched. Okay, so cranial nerve 5 is intact. And then I'm going to go ahead and palpate for TMJ now. So if you'll go ahead and open your mouth for me, do your jaw side to side. Okay, no tenderness, crepitus, or subluxation there. And next I'm going to check for cranial nerve 7. So I'm going to get you to raise your eyebrows for me. I'm going to get you to smile, frown, puff out your cheeks, and pucker your lips. Okay, very good. Next I'm going to go on to the ear assessment. First inspecting for shape and position. Looks good. I'm going to palpate the pinna and tragus for any masses or tenderness, none noted. And then I'm going to go ahead and look at the auditory canal and tympanic membrane. Okay, pearly gray tympanic membrane is intact. Intact over here as well, pearly gray, and no discharge noted. Next, I'm going to assess cranial nerve 8 for hearing. And so I'm going to do the whisper test first. Occlude that ear for me over here. Tell me, what did you hear?
1, 2, 3.
Okay, over here.
4, 5, 6.
Okay. Next, I'm going to check for, do the Weber test for lateralization. You hear it equal on both sides?
Yes.
Okay. I'm going to check the Rene test. You tell me whenever you stop hearing it.
No. No.
Okay. On this side?
No. No.
Okay, very good. Now I'm going to be looking at your eyes. I'm going to be looking at your eyebrows, eyelashes, and your palpable fissures. And I'm going to be looking at your sclera and conjunctiva for color, lesions, and discharge. Everything looks good. Next, I'm going to go on and test for cranial nerve 2. I'm going to test for visual acuity. So I'm going to get you to close one eye for me. Read the smallest line.
EDFCZP.
Okay, other eye for me.
EDFCZP.
And both eyes at the same time.
EDFCZP.
Okay. Then I'm going to check for peripheral vision. So I'm going to get you to look at me and you tell me when you see my fingers.
No.
Okay. Over here.
No.
Okay, very good. And so cranial nerve 2 is intact. Next, I'm going to check for cranial nerve 3. So I'm going to be checking for pupillary response to light. Okay, and I'm also noting consensual reaction. All right, now I'm going to check for accommodation and convergence. So look at my finger, look at the wall behind me, and then keep looking at my fingers or bring it closer to you. Okay, so pupils are equal, round, react to light and accommodation. Next, I'm going to check cranial nerves 3, 4, and 6 for extraocular movements in conjugate gaze. So follow my finger in the 6 cardinal fields. Very good. Next, I'm going to pop on my ophthalmoscope, and I am going to look for the red reflex and internal eye structures. Okay. Okay, red reflex is noted. And then after that, I'm going to move on to the nose assessment. Checking the nose that it's midline and straight, which it is. I'm going to get you to close your eyes and I'm going to assess cranial nerve 1 for smell. Tell me if you smell anything, what you smell.
Yes. Peppermint.
Okay. Next, I'm going to assess for nasal patency. So include one nostril for me, blow out gently. Other side. Okay, nostrils patent. And then next, I'm going to check the frontal and maxillary sinuses for tenderness, none noted. Then I'm going to go on to the mouth assessment. So I'm going to be looking at the lips. Open your mouth for me. The teeth, the gums, buccal mucosa, the palate, the tongue, underneath the tongue for me. I'll be looking at the salivary ducts, posterior pharynx, and the tonsils. I'm going to get a better look with my light. Every time I do that with my other hand. There we go. Okay. Now, say ah for me. Okay, I'm going to be looking at the tonsils. They are grade 1. And I am looking for symmetrical rise of phonation of the uvula and the soft palate, which I see, which is cranial nerves 9 and 10. Next, I'm going to just stick out your tongue for me. Cranial nerve 12. Midline with no fasciculations. And then I'm going to move on to the neck assessment. Looking at the neck for color, temperature, moisture, texture, edema. Looking at the turgor. Looking for any scars, lesions, bruises, or nevi. None noted. And then I'm going to be feeling the trachea, making sure it's in a midline position, which it is. I'm going to be feeling of the thyroid gland. Checking for any tenderness or enlargement there. None noted. Now I'm going to check for the carotid artery pulsation. And it's +2 on either side. And then I'm going to auscultate the carotid arteries for bruits. Okay, no bruits noted. So I'm going to go ahead and go on now to the posterior chest assessment. And from the posterior chest assessment, I am first going to be looking at color, temperature, moisture, texture, edema, the turgor, any scars, lesions, bruises, or nevi. Next, I'm going to be checking for any signs and symptoms of respiratory distress. So I'm going to be looking for any use of accessory muscles, any retractions, any tripod positioning. I'm going to be looking for any nasal flaring, any cyanosis, and any tachypnea, and none is noted. And so I'm going to go ahead and now look for any obvious deformities and symmetry. Everything looks good. Next, I'm going to be feeling for symmetrical chest rise. So I'm going to get you to breathe in for me. Okay, symmetrical. And next, I'm going to be feeling for symmetrical tactile firmness. Say 99 for me.
99. 99. 99. 99.
Okay, and that's symmetrical as well. Next, I'm going to be percussing the lung fields and all of the intercostal spaces. Okay, and then I'm going to be auscultating the lung fields. Starting above the scapula. Checking the lateral lobes. The lower lobes. Ensuring that I get the right middle lobe. Lungs are clear to auscultation. I'm going to check for egophony now. So I'm going to just say E-E-E.
E-E-E. E-E-E. E-E-E. E-E-E. E-E-E. E-E-E.
Checking for bronchophony. Say 99.
99. 99. 99. 99. 99. 99.
Very good. And next I'm going to check for whisper pectoralocally. So I'm going to get you to whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Very good. Go ahead and turn front for me. I'm going to now be looking at the anterior chest for color, temperature, moisture, texture, edema, the turgor, scars, lesions, bruises, or nevi. Everything looks good. Next, I'm going to be looking for any obvious deformities or symmetry on the anterior chest, and then I'm going to be palpating for symmetrical chest rise. So go ahead and take a deep breath in for me. Okay. And then I'm going to be checking for tactile firmness on the chest symmetrically. Say 99 for me.
99. 99. 99.
Okay, very good. I'm going to repeat the auscultation on the front. Starting above the scapula. Deep breath in. Okay, and now I'm going to do the cardiac assessment. So I'm first going to begin auscultating the heart sounds with the bell and the diaphragm. So I'm going to check the aortic pulmonic, herbs, tricuspid, and mitral. Aortic, pulmonic, herbs, tricuspid, and mitral. And then I'm going to be feeling here for the point of maximal impulse. And then I'm going to be listening for the apical pulse for 1 full minute, noting rate and rhythm. For time constraints, I'm not going to listen for that entire minute, but it is a regular rhythm, and S1 and S2 is auscultated. So now I'm going to get you to go ahead and lay down for me. And as he lays down at a 35 to 40 degree angle, I'm going to be checking for any jugular venous distension, any pulsations that are noted. And then I'm going to go ahead and inspect the chest for any heaves or lifts, which I don't see any. And then I'm going to palpate for thrills over the areas of cardiac auscultation. No thrills are noted. And then I'm going to go ahead and repeat my cardiac auscultation with the bell and the diaphragm while laying down. Pulmonic, herbs, tricuspid, and mitral. Aortic, pulmonic, herbs, tricuspid, and mitral. Everything is looking good. So I'm going to go ahead and move on to the abdominal assessment. I'm going to be looking at the abdomen for color, temperature, moisture, texture, edema, turgor, scars, lesions, bruises, or nevi. None are noted. I'm going to look at the abdominal contour and symmetry. And then I am going to go ahead and auscultate the abdomen. First, starting at the aorta, listening for any bruits. Then listening at the renal arteries, listening at the iliac arteries, and listening at the femoral arteries. No bruits noted. I'm going to be listening for vowel sounds in the 4 abdominal quadrants. It's normoactive. Next, I'm going to be percussing the 4 abdominal quadrants. Tympany is noted. I'm going to be now palpating the abdominal quadrants for any areas of tenderness or masses. None are noted. Next, I'm going to be palpating the liver. Deep breath in for me and blow out. Okay, no enlargement is noted there. I'm feeling for the spleen over here. Okay, no enlargement or tenderness noted there either. I'm going to go ahead and have you sit up for me. And then I'm going to check for costuver for CVA tenderness. I'm going to tell me if you feel any tenderness there.
No.
Okay, very good. Okay, next I'm going to go ahead and move on to the musculoskeletal assessment. So I am going to check first your hands, wrist, fingers, elbows, arms, shoulders for any nodules, crepitus, tenderness, any redness, swelling, deformities, and none's noted. And then I'm going to go ahead and check the radial pulsation and check for capillary refill. Okay, everything looks good. Less than 3 seconds and +2. And then I'm going to do your range of motion of your fingers. So I'm going to get you to flex down for me, extend out, hyperextend them. I'm going to get you to abduct away, adduct all together, and do thumb opposition right here. And then next I'm going to check the range of motion of your wrists. I'm going to get you to flex down, extend out, hyperextend up like this. I'm going to get you to, I'm going to get you to radial deviate inward and ulnar deviate outward, and then rotate all around like this. Okay, very good. Next I'm going to get you to do your elbows. I'm going to let you flex all the way up, extend out, and hyperextend them out. And then I'm going to check your shoulders now. So I'm going to get you to flex all the way up like this, extend all the way back down, hyperextend back behind you. You're going to internally rotate like this, and you're going to put your arms back down at your side. You're going to externally rotate out like this, and then you're going to abduct away from you like this, and then adduct all the way back down, and then rotate all the way around. Okay, very good. Next I'm going to go ahead and check your strength. So I'm going to get you to squeeze my hands for me. Strength is 5 out of 5. Check your bicep strength, pull up for me. Okay, 5 out of 5. Check your tricep strength, pull down. Okay, there you go, 5 out of 5. Check, go ahead and raise your arms outward, and we'll get you to pull down for me towards your body, abduction, and then adduction, and then push. Checking adduction, 5 out of 5 for shoulders. I'm going to check your strength of your shoulders, cranial nerve 11, so I'm going to get you to push up for me. Okay, and that is intact. And next I'm going to check your stereognosis and your graphesthesia. So I'm going to get you to close your eyes. You tell me what to put in your hand.
Cotton.
And then I'm going to have you tell me what to put in your hand.
Coin.
Okay. I'm going to check graphesthesia now. Tell me what I'm drawing in your hand.
Circle. Triangle.
Okay, and then I'm going to get you to open your eyes for me. I'm going to get you to do check for cerebellar coordination with rapid alternating movements. I'm going to get you to do finger opposition. Okay, I'm going to get you to now do the hand flops on your hand. Okay, on your legs. Very good. I'm going to get you to look at me and put your hand on your nose. And then you follow my finger wherever it moves. Putting your finger on there. There you go. Very good. Okay, so that is intact. And next I am going to go ahead and look at the all over upper and lower extremities for any warmth, edema, any redness, looking at the color, making sure everything is intact, everything looks good. Next I'm going to go ahead and assess for your sensations. I'm going to get you to close your eyes. You tell me where you feel this.
Left foot. Right foot. Left leg. Right leg. Right arm. Left arm. Left arm. Left arm.
Okay, you feel that equal everywhere?
Yes.
Okay, very good. I'm going to check for the vibratory sensation of your proximal ulnar prominence. You feel that on both sides?
Yes.
And your medial malleolus? You feel that on both sides?
Yes.
Okay, very good. And next I am going to go ahead and check for your deep tendon reflexes. So I'm going to check your brachioradialis, check your biceps, check your triceps, brachioradialis, biceps, triceps, check your patellar, check your Achilles, and I'm going to check your Babinski on both feet. Even though, there we go, everything looks good there. Okay, next I'm going to go on to your lower extremity assessment. I'm going to be looking at your feet, ankles, knees, and hips for any redness, swelling, deformity, tenderness, crepitus, nodules, any, and making sure everything looks symmetrical. I'm going to be now going ahead and assessing the dorsalis pedis pulses +2 and the post-tib pulses +2. I'm going to be checking capillary refill less than 3. I'm going to do the range of motion of your toes. So I'm going to get you to abduct away, adduct back together, flex them down and extend them out, hyperextend them up. Very good. Now I'm going to do your ankles. So I'm going to get you to plantar flex your feet into the ground, dorsiflex back up, and then I'm going to get you to invert, like inversion like that, and then evert back out, and then rotate. Very good. Next I'm going to check the strength of your feet. So I'm going to get you to pull back into dorsi, and then push into plantar flexion, 5 out of 5. Then check the strength of your legs. So I'm going to get you to pull back, flexion your knees, 5 out of 5, and press. Okay, that's 5 out of 5. I'm going to get you to abduct away, 5 out of 5, and adduct to me, 5 out of 5 for your hips. I'm going to get you to stand on up with me. We're going to do your hip range of motion now. So you're going to flex forward like this, extend down, hyperextend back behind you, and then you're going to abduct away to the side, adduct back to you. You're going to internally rotate, you're going to externally rotate, and then you're going to all the way around circumduct. Same over here. We're going to flex out, extend back, hyperextend. We're going to abduct away, adduct back to you, internally rotate, externally rotate, and circumduct. We're going to flex your knees up, flex your other knee up, and then we're going to extend knee out, hyperextend it, extend it, and hyperextend it. Very good. Next, we're going to go ahead and look at your spine. I'm going to be looking for your curvature, your alignment, making sure everything looks good there. I'm looking for any obvious deformities and symmetry. Everything looks good. I'm going to be looking for any signs of scoliosis, so I'm going to get you to flex all the way down for me. Okay, normal alignment there. I'm going to get you to go ahead and extend back up, hyperextend back. We are going to then laterally rotate side to side like this. And then we're going to, rotating, and then we're going to laterally rotate like this. Lateral flexion, lateral flexion, and then rotate. Okay, very good. Now I'm going to do your neck. So we're going to flex down, extend up, hyperextend back. We're going to laterally flex to the side and rotate, and then all the way around. Very good. And next we're going to, I'm going to assess Romberg. So I'm going to get you to stand with your feet together. Close your eyes for me. Looking for any swing, none noted. Open your eyes back for me. Go ahead and walk forward, assessing your gait. Heel toe back for me. Okay, gated steady. Next, I'm going to get you to hop on one foot and hop on the other foot. Okay, and that concludes my assessment.